Hello, you're welcome to Little Angel's Corner, your favorite channel for parental tips to assist in nurturing your little ones from birth till 10 years and beyond. I'm Dr. Stella. So today we're going to be discussing a topic that is quite interesting and is not uncommon. Have you ever noticed that your baby comes back from school itching all over and also maybe having some swellings on different parts of the body? Well, it may just be allergies. So, what are allergies? It's the body's reaction to the introduction of a foreign substance into the body. So the immune system reacts by the manifestations that we're going to be discussing under this topic, allergy. And it's not so uncommon. Quite a few families complain about this disorder. But there's nothing to worry about. It's just the body trying to manifest itself in a way that it does not recognize a foreign substance. So, what are these foreign substances that we're talking about? In effect, what are the causes of allergy? Firstly, the most common cause are foods. Some children react to certain foods. The major culprits are seafoods, that is, fish, fish products, crayfish, prawns, and other forms of sea products. And then also, some children react to dairy products like milk, cheese, yogurt. Each child has his own peculiarities. And then, aside from food stuff, some children also react to what they have inhaled in the environment, like dust, pollen grains, animal dander, and even the fumes from fried oils and a few other things. Then also, some children also react to contact, things that they get in contact with, such as their soap, their regular bath soaps. Some children react to it. After taking a bath, you see them just scratching away. And then some children also react to their body creams, their powders, different forms of things that baby has come in contact with. They do react to it. It's not unusual. And then, and sometimes some chemicals that may be kept in the house. Children also react to other things like medications, commonly even analgesics. So it's left for the mother to identify the culprit. What are the ways that the child can manifest with this allergy? There are various forms, but the commonest are skin manifestations in form of rashes, generalized body rash, or rashes that are just in certain parts of the body, especially the folds, that is the flexures at the elbows and the behind the knees. And also, they could also react by manifesting swellings that we call urticaria. They may react by they have swellings in different parts of the body. These swellings are itchy, and generally the child is uncomfortable. Then also they could react by excessive tearing from the eyes, redness of the eyes, itching the eyes. You know, the child is just uncomfortable, always itching the eyes. And some of them also react through respiratory signs like coughing, catarrh, and in some cases, wheezing. Some react with abdominal pain, some react by vomiting and also frequent stooling. There are various manifestations. Then the extreme form of this disorder could be what we call anaphylaxis, but this is not very common. But when it does occur, it's an emergency, and the child must be rushed to the emergency room immediately. The child presents with swollen face, the tongue is swollen, there's difficulty in breathing. So the child must be rushed to the emergency room, or better still, call the emergency number. So, how does a child that has allergy, how does the doctor investigate this child? Yes, you go to your healthcare provider, and your healthcare provider is going to take some tests. He's going to do what we call the skin prick tests, and what is expected, what you're going to, the child is going to go through in that. The doctor is just going to gently introduce a little nip, and then those food substances that the child may be reacting to, doctor is going to introduce them one at a time into that little nip, which is not painful. And a few minutes after, 10 to 15 minutes, there will be a swelling around that area if the child is allergic to that. Then also the doctor may run some tests, some blood tests. In the blood test, the doctor is trying to find out which antibodies are elevated according to the allergens that the child may have been exposed to. And sometimes also what happens is that we do what we call diet elimination. The mother is asked to suggest, to say what has she noticed, which foods does she think this child may be reacting to. So the mother has to be very observant, and so the doctor instructs the mother and guides the mother. Okay, remove, if you think it's eggs, remove eggs from the diet. Let's see if the child will still react in that manner. If you think it's fish, just like that, until the mother is able to hone down to which food exactly is causing this allergy in the child. So it's very important, mothers, that you're observant towards what may be causing the allergy in your child. You're going to really be a key factor in assisting the management of this child. And for you mothers, when you're at home, before you take to the hospital, what are the little things you can do before you take to the hospital if the signs are really exacerbated? What you can do is what we've been talking about all along. Avoid trigger factors. Of which allergens trigger this allergic manifestation in the child, i.e., the rashes, the hives, that is the swollen areas, the catarrh, the cough, or the excessive tearing of the eyes, is for you to notice, is it after having his or her bath with a particular soap, or is it after eating a particular kind of diet? Those are the things you have to watch out for. And then also, you have to keep a diary of all these culprits that you may suspect. And then also, you should have at home what we call antihistamines. They reduce the manifestation of this condition. They reduce the itching, the cough, the watery eyes. They are called antihistamines. They are over-the-counter drugs, so you can easily get from your reputable pharmacy shops. And finally, if the child should get into an emergency situation, it's good to also have to the hospital. Then it's reassuring to say that in most cases, children do outgrow allergies. By the time they get to their teenage age, most of them do not suffer these allergies anymore. The body somehow adjusts. It's able to identify and properly what it was previously rejecting. Because, like I told you at the beginning, allergy occurs when the body sees a substance that is actually not harmful, it sees it as being harmful. and then starts to react in this way. But as the child gets older, the immune system is better able to identify and cope with whatever the child introduces. So it's good news that in most cases, these children outgrow this condition. So isn't so much to worry about. It's a condition that the child can grow and thrive with. So I hope I've been able to allay your anxiety. And if you have any questions, please put in the comment section. I'll be sure to give you a response. Also, if you have enjoyed this video, do like, share, and subscribe so that together we'll grow a community of well-informed mothers with the aim of nurturing healthy children. Bye. See you in my next video.